The topic is bones and joints of the lower limb. Lower limbs are the last part of appendicular skeleton. As well as the upper extremities, the skeleton of the lower limbs is divided into girdle and a free part. The pelvic girdle in adult consists of two hip bones and the sacrum. It is a ring-like structure located in the lower part of the trunk. It connects the axial skeleton to the lower limbs. Let's take a look at the bony pelvis. There are two hip bones, sacrum and the coccyx. Let's focus our attention on the hip bones. Hip bones, innominate bones or pelvic bones, are the two irregularly shaped bones that form part of the pelvic girdle. The hip bone is composed of three parts: the ilium, pubis, and ischium. Prior to puberty, the three radiate cartilage separate these parts. Fusion begins at the age of 15 to 17. All three fused bones contribute to the acetabulum, the cup-like cavity for articulation of the head of the femur. Let's talk about the lateral aspect of the hip bone first, and we start with the ilium. It has body and a wing. There are four spines: anterior superior, anterior inferior, posterior superior and posterior inferior iliac spines. The iliac crest is situated above. There are also three gluteal lines on the lateral surface of the iliac wing: posterior, anterior and inferior. All lines serve as the point of insertion of the gluteal muscles. The next bone we are going to discuss is ischium. Basically, it has body and ramus. The biggest part of the body is ischial tuberosity. There is also the ischial spine on the posterior side of the bone. This spine is dividing the space situated behind the bone into major and lesser sciatic notches. The last bone is pubic. It has superior pubic ramus and inferior pubic ramus. We also can see pubic tubercle. Pubic tubercle is the point of insertion for the inguinal ligament. The acetabulum of the hip bone articulates with the head of the femur. Acetabulum consists of lunate surface, acetabular fossa, and acetabular notch. The medial view to the hip bone shows us some important landmarks from the lateral aspect: iliac crest on the top of the bone, anterior superior and anterior inferior iliac spines, as well as the posterior superior and posterior inferior iliac spine, and ischial spine situated below. The inner surface of the iliac bone is called iliac fossa. There is an iliac tuberosity on the backside of the iliac crest. Anteriorly and inferiorly to the tuberosity, there is an auricular facet, the articular surface for the sacrum attachment. It is the part of the sacroiliac joint. Arcuate line of the ilium continues to the pubic crest and forms the terminal line of the pelvis, the line dividing the greater pelvis and the lesser pelvis. Gender differences in pelvis. The adult male pelvis is narrowed and less flared, exhibiting an oval or heart-shaped pelvic inlet, and the angle of the pubic arc is less than 90 degrees. The adult female pelvis is usually broader and exhibits a round pelvic inlet, and the angle of the pubic arc is greater than 90 degrees. Pelvic girdle has a number of joints and ligaments helping to provide the function of movement and stability. Sacroiliac joint, it is synovial plane, connects auricular surface of the ilium to the sacral auricular facet. Hip joint is synovial joint between head of the femur and lunate surface of acetabulum. We will speak about it in details a little bit later. And finally, the pubic symphysis, semi-continuous connection between two pubic bones. Pelvic ligaments stabilize the pelvic girdle. Anterior longitudinal ligament of the vertebral column ends in the anterior surface of the sacrum. Iliolumbar ligaments connects the bodies of the lower lumbar vertebrae with the iliac crest. Anterior sacroiliac ligament passes between iliac tuberosity and the lateral margin of the anterior sacral surface. Ischial spine is connected to the sacrum via sacrospinous ligament, sacrotuberal ligament, passes between ischial tuberosity and the sacrum. Inguinal ligament starts on the anterior surface of iliac spine and attached to the pubic tubercle. It has very important role in abdominal surgery. And finally, obturator membrane closes the obturator foramen and leaves just a small canal known as the obturator canal for the blood vessels and the nerves. The dorsal view to the pelvis shows us some of the previous view ligaments: iliolumbar, sacrotuberal ligament, and a small portion of the sacrospinous ligament. We also can see some new ligaments, dorsal sacroiliac as an example. Okay, let's return to the osteology and continue with the femur. It is the long, tube-shaped bone, the longest bone in our body. The following pictures are the anterior aspect and posterior aspect. As a tube-shaped bone, femur has proximal epiphysis, diaphysis or shaft, and distal epiphysis. Proximal epiphysis consists of head with fovea capitis, the point of ligament attachment, neck, greater trochanter, lesser trochanter, intertrochanteric line on the anterior surface, and intertrochanteric crest on the posterior surface. Crest is more prominent than line, so we can distinguish the posterior surface. There is also a small fossa on the posterior surface known as trochanteric fossa. It is situated right behind the neck near to the greater trochanter. Lower to the trochanteric crest there is a gluteal tuberosity, the point of gluteus maximus muscle insertion. Asperal line starts on the posterior surface of the diaphysis of the femur and continues to the distal epiphysis. In this area it spreads into medial supracondylar line and lateral supracondylar line. These lines boundaries the popliteal surface of the femur. Distal epiphysis composed of lateral epicondyle and medial epicondyle, lateral condyle and medial condyle, participating in the formation of the knee. An intercondylar fossa is situated between condyles on the posterior surface, while the patellar groove is located on the anterior surface just between the epicondyles. Let me tell you about the hip joint. It is synovial, ball and socket. Articular surfaces are lunate surface of acetabulum and head of the femur. Capsule attaches to the intertrochanteric line on the anterior surface and intertrochanteric crest on the posterior surface. Additional elements are intracapsular ligaments, ligament of head of femur, and transverse acetabular ligament covering the acetabular notch. The extracapsular ligament are iliofemoral ligament, pubofemoral ligament. Both are situated on the anterior surface, and ischiofemoral ligament situated on the posterior surface. Now let's discuss the tibia and fibula. Both are long, tube-shaped bones. Tibia is situated on the medial side of the leg, fibula on the lateral. Both has epiphyses, proximal and distal, and a shafts, diaphysis. Proximal epiphysis of the fibula is known as head, distal is lateral malleolus. Two bones are connected by the interosseous membrane. It attaches to the both interosseous margins of tibia and fibula. Some important landmarks on the tibia before we speak about the knee. Tibial tuberosity on the anterior aspect, soleus line on the posterior. Anterior margin of tibia is sharp and located just under the skin with subcutaneous fat, and medial margin. Interosseous margin of tibia is covered by the interosseous membrane as well as in fibula. Let's take a look on the fibula shaft. This picture is medial point of view. There are three margins on fibula: anterior, posterior and interosseous, situated very close to the anterior. There is also apex on the head of the fibula and malleolar fossa on lateral malleolus. Now you can distinguish between proximal and distal ends of the fibula. Knee joint, the most complex joint in our body. It is connection between superior articular facet of tibia, lateral and medial condyles of femur, and patella. Two menisci help in the formation of the knee joint. Before we continue with the additional elements of the knee joints, let's take a look at the top side of the tibia proximal epiphysis. First of all, it is a right tibia because we can see the tibial tuberosity on the bottom of the picture, and we know that tibia is always on the medial side of the leg. Superior articular facet of tibia has two condyles, medial and lateral, both corresponding to the femoral condyles. Menisci, the main additional elements of the knee, lies on the tibial medial and lateral condyles. There is also prominence between condyles. It is called intercondylar eminence. It separates the intercondylar area into anterior and posterior. Cruciate ligaments of knee attach to intercondylar area. The other point of attachment is situated within the intercondylar fossa of femur. Now, let's take a look at the knee joint once again. The menisci lie on tibial articular surface. Anterior cruciate ligament attaches to the anterior intercondylar area. Posterior cruciate ligament attaches to the posterior intercondylar area. Knee joint also has extracapsular ligaments, medial collateral ligament and lateral collateral ligament. Finally, the last part, foot. Foot connects to the both tibia and fibula via talocrural joint. It has 7 spongy bones in tarsal area and 19 tube-shaped bones in metatarsal and toes. Here is the superior view to the foot. And on this side you can see medial and lateral views. Foot composed of 3 major parts: tarsal area, metatarsal and toes. 7 tarsal bones are talus, calcaneus, navicular, cuboid and 3 cuneiform bones, medial, lateral and intermediate. 5 metatarsal have same structure. Each bone consists of basis, body and head. The biggest bone is situated medially and it is called first metatarsal. We also have an important landmarks in this region, tuberosity of the 5th metatarsal bone. Let's talk about joints of the foot. There are 3 important joints in the foot area: talocrural, mid-tarsal joint or Chopard joint, tarsometatarsal joint or Lisfranc joints. The connection between inferior articular facet and malleolar articular facet of tibia with fibular malleolar articular surface and talus is called talocrural joint or ankle joint. It is synovial, hinge type. Ligaments of talocrural joints: deltoid ligament on the medial side, posterior and anterior inferior tibiofibular ligaments on the lateral side. There are also anterior talofibular ligament and calcaneofibular ligaments on the same side. Joint between the talus and calcaneus on the one side and navicular with the cuboid on another side is called mid-tarsal or Chopard's joint. The joint line goes here, and the bifurcate ligament is a key to this joint. Lisfranc's joint or tarsometatarsal joint is a joint between cuboid and cuneiform bones on the proximal side and metatarsal bones on the distal side. The line of the joint goes here. Both Chopard's and Lisfranc's joints have an important clinical role. Amputations of the foot are performed through the lines of these joints mostly. So, the topic is over. Thank you for your attention.